was 21 years ago. It's hard to believe. I was pregnant with my third child, and I just started swelling and was going back and forth to the doctor all the time because I was getting headaches, and they were testing my blood pressure. They said it was a little high, but it's okay. I would go back and they check the protein in my urine, and they say it's a little high, but it's okay. And so that went on for a couple of months, and then I got to the point where I could no longer lay down. I was in such pain in my upper stomach that so I called the doctor. My doctor was out of town. And I remember talking to my sister who was in Chicago, and she said, "What's going on?" And she wanted to know how I was feeling, and I was complaining about the pain in my stomach. I told her I couldn't sleep, and so she said, "That's crazy. Something is wrong." They went to a family reunion I was supposed to go to. I couldn't go to because I was feeling so bad. And she was there with my cousin who was a physician. And she said, my sister told her my symptoms. And she said, "Tell your sister, get her on the phone right now." She said, "Tell her to go to ER right now." And she gave me 2 tests to tell the ER doctor. And so I get to the hospital, I give the doctor the test, they run the test, and sure enough, my liver is malfunctioning. My platelets are so in such bad, at such low levels. And so immediately they said, "We have to induce you. We're going to try to induce you to see if we can avoid surgery, but you've got to deliver now." Long and the short is, they did all that. I went into labor right away. I delivered my son, who was getting ready to turn 21, but I gotta do something. I know there's different organizations that are doing things, but I'm still seeing too much in our community. And so I was at lunch with a friend, and as we were sitting there, my husband's a pastor. He was called to a home where a family had just lost a loved one, and which is not abnormal, but this one hit differently. This was a mother who died in the bed with her baby because she was sent home with pre-eclampsia, and no one treated her. And so she died, and her baby was in her bed with her. And so that was my moment of reckoning, like, okay, you can no longer sit quiet. You know what that's like. And something has to change. Something has to be done differently. And so as we have come, May is Pre-Eclampsia Awareness Month. And so as this month has come, and I don't hear anything about the awareness, I've not heard anyone talk about it, I'm like, okay, this is the time. This is the time for me to build some awareness. And so on May the 22nd, which is World Pre-Eclampsia Day, we will be hosting a Pre-Eclampsia Awareness Symposium. And what we're doing is we invited some moms who can share the testimony along with myself about what their experience was, and some doctors and nurses and people in the profession that can speak to that disease and begin to create an awareness, particularly for Black and brown communities who often get overlooked. They're just not paid attention to.